Hello. We at the Cleveland Clinic would like to get your opinion on a new special radiology imaging report that we are thinking of providing for patients. Before we discuss the new report, we will provide a bit of background on how imaging fits in with your healthcare. When you have an MRI, X-ray, or other imaging study, the images are sent to a type of doctor whom you may have never met, called a radiologist. A radiologist is a doctor with special training in the interpretation of medical images, often with very focused training in imaging of one specific system of the body. The radiologist analyzes your images carefully and then creates a written report that is sent to your doctor to tell him or her what the radiologist believes may be causing your symptoms. Your doctor uses the information in the report as well as other information to help diagnose and treat you. The written report that the radiologist makes often contains technical medical jargon, which is useful for communicating with other doctors, but can be confusing to patients, as you can see here. We think that patients may be interested in being shown the results of their imaging study directly from the radiologist, with a special video report which explains the findings better. In addition, we would like to provide information about the radiologist who interpreted your imaging study and information about the type of study that was performed. Ideally, your new report would contain the traditional written report plus the new video report. The new report would contain separate sections, including a radiologist introduction, an explanation of your imaging test, an explanation of normal anatomy for the area you had imaged, and your personalized diagnosis. For the purpose of this sample, we have shortened or combined some of these sections. Please watch the following sample of the new video report of a knee MRI.
Hi, I'm Dr. Josh Polster, a board-certified radiologist. I'm actually your radiologist, and I'll be sharing my opinions on your imaging study with you later in this presentation. I have a very focused area of expertise, interpreting images of the musculoskeletal system. That means that I have additional training and expertise in evaluating medical images of structures like bones, joints, ligaments, muscles, and other parts of the musculoskeletal system of the body. For education, I attended Case Western Reserve University for medical school, followed by 4 years of residency training at Johns Hopkins Hospital, and then an additional year of specialty training at the Cleveland Clinic. I work closely with doctors like orthopedic surgeons and sports medicine doctors to try to provide patients like you answers to problems that they're having so that you can get the best treatment possible.
We're going to look at your knee MRI today, and I want to start by first just explaining kind of how the images look on MRI. The MRI machine is able to create images in any imaging plane, and what it does is it sort of creates these slices through a body part and shows them as two-dimensional representations like this. So this is us looking at a knee from the side, much like I'm looking at your knee here. Okay, so this is the front of the knee and the back of the knee. And you can stack up those slices so that you can scroll through them and identify all the parts of the knee inside. And you can look at other different kinds of perspectives as well. You can get image slices that look like this or other planes as well. But going to your knee specifically, I want to point to a particular structure, a couple of structures, to show you what's going on. So first, there's an important ligament in the knee called the ACL, or anterior cruciate ligament. It connects the femur bone to the tibial bone, and this is what it looks like in a drawing, and this is what it looks like in a normal knee on an MRI. This ligament is very helpful for keeping the knee stable and in place, and if it gets injured, when it gets injured, the knee shifts around a lot and feels unstable and can injure other structures as well. If you look at your knee, and I look in the area where we expect to see the ACL, notice it looks different than in the normal example. Instead of being kind of a sharp line that's black, it's somewhat ill-defined and thick. There are even some white areas in the middle of it. This indicates that the ligament is injured. And often when that ligament gets injured, you get another finding as well, which are these areas of white in the bones, the femur bone and the tibial bone. These are bone bruises, and the fact that you see one here and one here implies that the bone has shifted forward, banged against this area, and then shifted back. And that is a classic finding of an anterior cruciate ligament, or ACL, tear, unfortunately. In addition to that, I want to point to a different structure that is a normal important structure in the knee, and that's called the meniscus. The meniscus is this sort of C-shaped structure, and this is as if we're looking down from head to toe down at the knee. And these structures are important cushions in the knee. In the MRI, normally these look like little black triangles like this, and this is on the outside of the knee, or in your case the left outside of the knee, or the lateral part of the knee is out here. That's what that structure looks like. If you look at your knee MRI and you look back here, notice the difference. The meniscus is very small and it's kind of indistinct. And instead of there being one triangle in the front, you see two triangles. So what's happened here is this lateral meniscus in the back has torn and flipped forward to about this area in your knee. So overall, you've got three findings here. You've got a tear of the anterior cruciate ligament, bone bruises, and a meniscus tear along the lateral or outer part of your left knee.